Hello, everyone, and welcome to another episode of Fiscal Fridays. If you enjoy this show, please like this video and subscribe to this channel to keep Idaho Freedom content in your newsfeed. The Idaho Medicaid program is growing at an unsustainable level, approaching $4.7 billion in the current fiscal year. That is a 17% increase from last year, making up 1/3 of all the dollars spent in the Gem State. You hear this all the time from the IFF and other respectable conservative outlets, but what does this really mean? More importantly, what is all this business about lawmakers trying to change how we pay for Medicaid? Would it really save money for the taxpayers? To break all this down, here are 3 things you need to know about Medicaid and how it affects you, the taxpayer. The first thing you need to know is that Medicaid and Medicare are 2 very different programs. Medicare is the federal entitlement program that takes money out of your paycheck to cover medical services for the elderly. It does not go into some government savings account in DC. Rather, it uses money you pay now to cover the people on the program now. Then your kids and grandkids will pay for you when you retire. But this is a whole nother rabbit trail that we won't get down in this episode. Medicaid, on the other hand, is a government medical welfare program that is operated by both the states and the federal government. The program initially designed for low-income pregnant women, their children, the elderly, and the disabled. After Obamacare, the program expanded to able-bodied, working-age, childless adults who fall below 138% of the federal poverty level. Idaho added the expansion population in 2020. According to the latest numbers, this population constitutes about 30% of all enrollees on the program, about 125,000 people. For perspective, that is slightly less than the total population of Meridian, Idaho, the state's second largest city. The federal government pays the bulk of Medicaid costs. For Idaho, non-expansion population equals about 70% of the total cost. But to encourage states to adopt expansion, the federal government pays 90% of the cost for the expansion population. This seems like a good deal, but studies from groups like the Mercatus Center have shown that prioritizing the expansion population over the truly needy diverts resources, particularly harming children and the elderly populations already on the program. The second key factor to understand is what is driving the cost of the program. Some have focused on the fact that prescription drugs are the fastest growing expenditure category in Medicaid, but this is not the leading driver of costs. The expansion population was a much larger contributor of both overall costs and prescription drug use. The expansion population contributed to 55% of all new spending over the last 5 years, which is about $1.6 billion in total. Interestingly, they will also be a key driver of the prescription drug spending, with prescription drug claims outpacing expansion enrollment growth by 50%, while use of all other services remained relatively flat. In the midst of all this, legislators are looking to switch Medicaid from a combination of fee-for-service, managed care, and value-based systems to a purely comprehensive managed care system. Currently, Idaho pays for most services directly to providers as enrollees use them. Under managed care, Idaho would pay an insurance company called a Managed Care Organization, or MCO, a flat monthly fee per beneficiary, then allow them to pay for the costs. This sounds good on paper, but ignores many of the reasons why Medicaid is becoming so expensive. For example, it does nothing to address rampant enrollment, use, or service costs. In fact, managed care is not a new concept. About 41 states have adopted some version of the policy, and 35 cover at least half of their populations under it. Nonetheless, these states did not demonstrate any better cost control than the rest. For perspective, even with our budget woes, Idaho still fares better than its managed care peers on state spending cost control. All of these points lead us to ask a very tough question. Why do we have Medicaid? Better yet, why are our policy goals oriented to getting more and more people on the rolls instead of helping them get off the system and lead independent lives? The fact is, dumping money into medical welfare is far from a benevolent approach. Let's look at psychotropic drugs, for example. These are medications designed to treat mental health conditions. They constitute 1 in 5 Medicaid-covered prescriptions and an estimated $91 million in spending in 2022. Sadly, the system is not geared toward helping these people, but one that feeds big pharma and leaves beneficiaries dependent on the government to receive their medications. The Milbank Quarterly reports that Medicaid beneficiaries are more common than the rest of the population to be taking multiple psychotropic drugs at once, a very dangerous practice that one study from Emory University found was prevalent in Idaho. The goal of Medicaid needs to be reoriented to getting people off the rolls and in charge of their own healthcare decisions, rather than be dependent on what the government has decided for them. In sum, Medicaid is a joint state-federal entitlement that boasts huge annual cost growth to the taxpayer. These costs are driven by expanding the welfare state, and solutions are ignoring the reasons why we are here in the first place. It is time that conservatives take a second look at Medicaid and decide how to counter the growth in the welfare state rather than enabling it to grow for years to come. For more episodes of Fiscal Fridays or other great content from the Idaho Freedom Foundation, please visit idahofreedom.org. Thank you very much.